Good evening, and thank you for joining us for the webinar on diabetes reversal and smart eating. I am Dheeraj, CEO of Navrelia Foods. Today, we have a couple of excellent speakers with backgrounds in nutrition, food, and medical sciences. This webinar will last for 1 hour. We'll start with short presentations from the speakers, followed by a conversation between the speakers. Finally, we'll have an audience Q&A, so please do keep typing in your questions and keep them coming in throughout the webinar. With that, let me introduce the speakers. Our first speaker is Mrs. Sandhya Manian. Sandhya is a Chennai-based holistic and integrative nutritionist with a master's degree in dietetics, sorry, dietetics and food service management. Through Wellness with Sandhya, she offers transformative training programs and personalized diet consultation programs to a global audience with focus on metabolic disorders. Our second speaker, Dr. Raghunath Kajagadda, is a founding member of Navrelia Foods and a practicing cardiologist at Emory University Hospitals in Atlanta, USA. He's passionate about pursuing scientific interventions to improve public health. Most recently, he started a fitness program for women in peri and postmenopausal phase. Now, I invite Mrs. Sandhya to share her approach on diabetes reversal with us.
Thank you, Dheeraj. Thank you for the invitation, and that was a wonderful introduction. And thank you all. While I'm pulling out the presentation for you, I would like you all to be more participative, though you can't you can only see me, but I can't see you. But I would like to interact with you through the chat box. So keep your fingers on the keyboard ready. And I would like to know where you're all from, which city. So please type in your city names as I begin the presentation. So I would like to know where you're all from. Do I get to see you on the chat box? Hello, hello. Are you all there? Anyone from Chennai? Am I audible?
Yes,
Okay,
you are audible.
okay, okay. Is this morning for you all or evening? Where are you from?
There are a few people who are raising their hands, so I presume that's a yes to your question about
Okay, okay,
you're from
okay.
Chennai.
I didn't get to see that. Okay, all right. Great. Okay. So is there anybody who's here because you have diabetes or your family member has diabetes or you're in the helping profession where you're dealing with a lot of diabetic people? If yes, please type D in the chat box. And with that, we will begin the presentation. You all
Uh,
get to see the
yeah,
chat box?
uh, Sandhya, yes, I think the chat box is disabled for this webinar. The only thing that's
Okay.
open is the Q&A. I think one of
All
our
right.
participants mentioned that.
Fine. Okay. So let's move on then. Okay. So why this question is because almost 130, the recent research says that 130 million people in India are pre-diabetic. So it's like almost 1/5 of the population is already pre-diabetic. And we all know that we are topping in the list of diabetes in the world rank. And so my profession or my passion is actually to help us get down on the ranking list and so this presentation. Okay. So this person that the case that I'm going to present today is something that you will all resonate with. Either you have some symptoms or all the symptoms, or you know somebody who's going through all of this struggle. So that's why I pulled out this for you all. And we will call him Raju. And this person is a middle-aged person, 38 years old. We can say quite young, not even middle-aged, just getting into the middle age. And he was diagnosed for diabetes post-COVID because that's when he started seeing many symptoms, and then he felt so uncomfortable. So he went for a test and then figured out that he's diabetic. So he's also facing digestive issues like acidity, constipation, bloating, flatulence, and feels so low in energy through the day and very low after lunch, because of which he needs to take several mugs of coffee in a day to keep himself alert for his work. And his sleep in the night is also very much disturbed because there is frequent urination in the night. And it's like a vicious cycle because he's not sleeping well in the night. The next day he's feeling sleepy. Because he's feeling sleepy, now he has to have some extra coffee to keep himself awake. So this vicious cycle keeps going on and on. And he's also very hungry through the day, and his body shivers when he doesn't eat the food immediately. I think this is a very, very common scenario whenever someone is facing pre-diabetes or diabetes. No matter what, I just finished my meal, but I'm feeling hungry. This is a very difficult problem for almost many. And when you don't eat, or when you try to tell yourself a logical reason that you just had the food and you're avoiding food, then you end up with acidity, bloating, flatulence, all of those issues, right? So this was happening in him also. And he recently quit smoking, so that might also add to more appetite, more hunger. And he takes occasionally alcohol, so he's not even alcoholic to say that it contributed to his health issues. And very very different job nature, so this might not be common with all of you all, but most of you might be working late in the night, or might having 5 days of work week and 2 days of a different weekend life. But for this man, he used to live in India for 1 month, and 2 months he remains in some other country. So he has a different kind of challenge with respect to his meal options. But for most of us, we might not have this particular challenge of availability of food. But this gentleman had that complication also. And these are the medications that he was taking. He was taking anti-diabetic medication. And his food routine, if you look at it, is very common, like coffee or tea in the morning along with a biscuit. And then there is a breakfast, which is paratha along with coffee again. And then 11 o'clock is his meal time, which is little unusual. Usually for most of us, it's around 1 o'clock. But for him, in his factory, it is at 11. And again, 3 p.m. coffee, again, 4 p.m. coffee. Again, he's hungry in the evening. So there is a porridge. And then, because that's the simplest and easiest food that he can take. And he has rotis, at least four. That's when he feels satiated. And beef or chicken curry is what is available for him. So he takes that. And if you look at his parameters, his HbA1c is 8.2. His fasting is 106, which is not too much, but HbA1c is alarming. Postprandial is 181. He has vitamin D3, B12 deficiency. LDL is very much in place. HDL has to improve, and triglycerides are also not in place. So if you look at these reports and if you look at the symptoms, this is a common scenario, at least one person inside the family member of many homes in India. So before we go into Raju's case further in detail, there is something very important for us all to know when we have to tackle pre-diabetes and diabetes. Earlier, when I studied nutrition about 20 years back, all about diabetes was cut sugars. Don't eat sugar, don't eat sweets, stay active. That was the norm. But so many research has been happening in the last 2 decades that there is so much improvement in the field, because we know that the problem is growing. So the research is also growing in the country. So we have a lot of data to tell us what is helpful for us to prevent diabetes, or to reverse diabetes, or to remit diabetes. So two important concepts we have to understand when we have to tackle with the diabetes remission is glycemic index and glycemic load. You might have seen the advertisement saying low GI rice or low GI biscuits or low GI food, but what is actually low in GI? Glycemic index is basically a numerical way to say how the food that you have eaten is rising the blood sugar levels in your body. And the reference is usually, if an X person takes glucose, his spike is 100. If the same person is going to take, say, a slice of bread, what is the amount of spike in reference to the glucose that he had taken before? So it's a research based work, and then it gives a value. And for most of the foods, you can categorize them into GI, whether it is a low GI or a moderate in GI, or whether it is high in GI. Basically, glycemic index measures the carbohydrate quality in a food. And a lot of factors actually influence GI depending on how a food is processed. For example, if you're having a dalia khichdi, it can be under low GI. But if it is milled to flour and then you make a roti, it falls into moderate GI. And if you're making a refined product and making a bread, which is white bread, then it can fall under the high GI category. And but in this, the missing thing is how much a person is eating, what the person is eating along with it. So then comes the concept called glycemic load, because we don't eat only a slice of bread, or we don't eat only a cup of oats. We have so many things in addition with it when we eat a meal as a meal. So what becomes more important is to understand something called glycemic load, where it takes into account the glycemic index and also the amount of carbohydrate that goes in per meal. Basically, the portion size of meal and what comprises in a meal, that makes the GI little lesser. So that becomes a glycemic load. And it's a new way to assess the impact of the carbohydrate that is consumed on the rise of blood sugar levels in the body. And glycemic load is what actually gives you the accurate level of how the blood sugar levels are going to be impacted after you have a particular meal. So in this also you have the category called low GL, moderate GL and high GL. So depending on how a food is combined, it can be a low glycemic load, or it can be of moderate GL, or it can be a high GL. So combination in which you eat a particular food can affect the glycemic load, or the combination in which a particular food is designed can affect the glycemic load. Okay. So this is the glycemic index and glycemic load of some common Indian foods. This particular data is not really reliable when you look into Google, because it can vary how it is milled, and you can go blinded. So look for reliable sources when you look for glycemic index and glycemic load data. So for example, wheat flour has a GI into moderate range about 62, but the glycemic load of wheat flour can be lesser, 23, because the amount of rotis that one might take is going to influence the glycemic load, and the amount of carbohydrate present in wheat flour is going to influence the glycemic load. So the glycemic load can be lesser when you take, when you compare GI versus GL, the glycemic load of wheat flour can be lesser. So it means still it is a safer food option. If you look into the, so many food options that is indicated here, you will see difference in GI and GL, that a food that is low in GI is not necessarily low in GL, or a food that is high in GI is not necessarily high in GL. So what it tells us is something more important to look in between the lines and then decide on what a person should be eating. So we'll get back to the explanation. Now, what did Raju eat and what was the result after 8 weeks? If you look at his results, in 8 weeks time, his HbA1c slashed from 8.2 to 6.2. His fasting sugars in range, and in PP is still a little in progress, but it's very much closer to the range, and all his deficiencies is sorted. His triglycerides can come down further, and LDL is already in place, but his HDL has to improve. And with respect to symptoms, these are the biological thing, but with respect biochemical thing, but with respect to symptoms, all his digestive issues got sorted. His energy levels improved. There is absolutely no slump at all. So his necessity to have extra mugs of coffee in a day is now reduced. His necessity to look for some snack here and there in a day is reduced, because we always think, oh, my energy is low, so now I have to eat something. If I eat something, I might feel better. This is again a common vicious cycle that people undergo. And his sleep quality also improved, because his energy is in place and his sleep is good. Now he feels motivated that he can do some workout. And importantly, the urination at night has declined drastically, that he is sleeping like a baby. That's what he told me. And his hunger pangs are largely under control. And his medications also, the doctor has cut down the medication. He has reduced it to half, because of the amazing control that has happened within 2 months span. And the doctor has assured that if you're going to bring it down further and then maintain it, then we'll taper down the medications further. This is a great assurance for anybody who's looking for diabetes remission or diabetes reversal, because your medications, you should not stop them like that. It should be stopped under guidance and slowly and steadily and strategically. So what did he eat? If you look at his meal plan, it was very basic, simple meal plan, but the simple meal plan always had a balance of a lot of vegetables and a good amount of protein and a moderate amount of carbohydrate. So he didn't have to give up his rice. He didn't have to give up his rotis. He didn't have to give up his normal meal, which one could eat. But some things are strategically placed. So if you look at few things, there is something called jeera tea, then there is something called methi powder with his buttermilk. And if you look at his breakfast, it doesn't have much of carbohydrate. It is largely vegetables and eggs. So basically it is protein and fiber loaded. And his lunch has a certain proportion. It is designed in a certain way. And in dinner, because this person doesn't have access to vegetables in dinner, it may or may not happen. It's like they get their supply at the beginning of the week, and by the end of the week the supply gets reduced, so he might not have access to vegetables. So in such special cases, we will add a fiber which is going to facilitate the fiber which is very much equivalent to fiber that you will get from vegetables. So whenever vegetable is not available, he's going to add jackfruit, tender jackfruit flour to his meal. Yeah, so this is what he ate, that this is how he saw the results. So what did Raju change in his lifestyle, and what was the thing that we looked into? So 80% of the effect came from these things. Number one is addition of fiber when vegetable is not available and insisting on vegetable intake whenever he ate his meal, and chewing enough, because when you chew your food enough, at least 10 to 15 times, it is going to reduce the post meal spike. Why? Because the GLP-1, like glucagon, like peptide, is going to be produced in the small intestine when you're chewing enough. And research says that 10 times the capacity of insulin to be produced in the body and for the glucose to go and get locked into the cell is going to increase 10 times by 10 times when you're going to chew the food and eat. Likewise, when you eat in a certain order, which is vegetables first, and then you have the protein, and then you keep the carbohydrates for the last, then about 30% of extra amount of GLP is going to be produced. Now, why this GLP is very important? Because GLP plays a crucial role in increasing the insulin release in the body. And also it signals the brain to suppress the appetite. So the most common problem that people with diabetes or pre-diabetes face is consistent hunger, huge appetite, and lack of energy. And there is also a important problem that is not like the elephant missing in the room is your insulin resistance. So when you modulate the GLP through your diet and with the order of eating, with the amount of chewing, and also you're taking a food which is low in GI and low in GL, all of this factor is going to enhance the production of GLP-1, and that is going to be of great help in regulating your blood sugar levels and bringing them down. So when we look at it from the superficial level or at the bird's eye view, just make sure that you're maintaining the order of eating, which is vegetables first, followed by the protein, and then you're having your carbohydrate rich food. For example, just have a cup of vegetable curry or a cup of vegetable soup or a cup of vegetable salad, and then you go on with the main course where you're having your protein, which could be your vegetarian protein, say dal or chole or rajma, or you're having your chicken or your fish curry along with rice. And if at all, if there is an event like Diwali or you have a function, you're tempted to have something that is sweet, this is the time to put in that small amount of sweet, but after doing the fiber and the protein. So you are tricking the blood sugar levels that it is not spiking badly. So if you're going to keep it at the beginning, or if you're going to have the sweet somewhere as a snack, then you're not your blood sugars are going to go out of control. But if you maintain the portion size and keep it in between and keep them occasional, then you can still have sweet here and there occasionally and still maintain your sugar levels, provided you follow everything. Okay, so portion size is very, very important, especially with carbohydrates. If there is a particular amount of portion size, say 1 cup or half cup or 100 grams, make sure that you're maintaining it. And another factor that will enhance your blood sugar levels to be under control is when you have a meal in a day which doesn't contain any carbohydrate at all, very minimal amount of sugar is present in it, especially your breakfast. So chuck your cornflakes, chuck your oats, porridge, or chuck your muesli or a fruit-based sweet type of breakfast in the morning, and make sure it is loaded with vegetables and fiber, and that will really help you in managing the energy levels and appetite in a day. So this is the major factor. These are the major factors that Raju followed, and that helped him shift his blood sugar levels within 2 months span. And what else contributed to his effect is the 20% effect, which is movement after every meal, especially after lunch and dinner, 15 minutes of walk. So this could be in a corridor, this could be in his office, or this could be inside his room, or this could be a treadmill in his place. But if this is done, anybody can bring down the post meal spike, and that's going to be very, very helpful. And the functional foods like jeera and fenugreek, these have the capacity to improve your digestion and aid your digestion and prevent all the digestive issues and also improve the insulin sensitivity. So there is n number of research to say how maybe is influencing the insulin sensitivity in a person, and how jeera is also influencing these factors. So keep them as very important. It might look very subtle. It might just look like it's a spice box, but make sure that it is incorporated in your diet every day diligently. And also make sure that if you're having any deficiencies, it needs to be supplemented under guidance. Now, what will happen is people usually look at the supplements and they feel that, wow, if I take the supplements, all of my problem is going to be solved. No, it is only the 20% effect. And supplements also has its lifespan on how much you should be taking it, when you should be taking it. You can't prolong your supplements on a longer span because that also has side effects. So make sure that it is taken in a certain way. So we gave him B12, because medication, metformin especially, can cause a deficiency in B12. And if there is a deficiency of B12 vitamin, that can increase the risk for diabetes. So, and correcting his B12 is crucial. And D3 is an important vitamin. It not only plays a role in improving the absorption of calcium, but it plays a role in also reducing the fatigue levels in the body, improving the energy levels, and then it improves the sleep when taken in the night. When there is enough D3 during the day, then the melatonin in the night is going to be secreted better. So the level of calmness that the person will get when there is enough D3 is going to be tremendous. So T3 again is very important. It also modulates the pathway, and it also has the capacity to influence the gene expression. And then there is chromium, zinc, and selenium, which is going to reduce the insulin resistance, and it brings out better glycemic control. And when you take enough, whenever you're eating fish, you don't need to supplement your omega-3. But when there is not enough fish or enough omega-3 fatty acid scope for enough omega-3s in your diet, then it is better to supplement. And that is going to be neuroprotective. So it is going to protect your neurons, your cardiac health, and a lot of other factors. It also helps in improving the HDL. So this is what we did for Raju. And Raju is not only that one person, but any Raju or any Sita or any Rama who is facing pre-diabetes or diabetes will resonate with these, will have many similarities with whatever I have said. So make sure that you're following a diet which has low in GI, and you know what is the GL of the food. Make sure you maintain the order of eating, and then maintain the portion size of carbohydrate, and make sure that you're having enough physical activity in a day to take a control of your blood sugar levels, and that will help you to remit and reverse the condition. So now over to Dheeraj, and then I'm very eager and looking forward to listen to Dr. Raghu, and I have a lot of questions to ask him. Yeah, thank you.
Well, thank you, Mrs. Sandhya. That was really insightful. So I was just taking some notes, and by and large, there were three key takeaways from me. One was importance of making sustainable changes for disease management reversal. The second one that I noted was diet and the role of diet and dietary practices, which is really important. So where you're talking about, I think, mindful eating and being deliberate about the choices that you make for your breakfast, or adding more veggies and things like that. The dietary practices, as well as the choice of the products that you or food that you choose for diet, are also important. And then the third one was, in terms of dietary choices, you'd recommend for looking up the glycemic index and glycemic load values, and do some proper research rather than just going by what people are saying. Okay. With that, now I invite Dr. Raghu to share his views on the disease management and reversal.
Good evening or good morning, everyone. It's morning here in Atlanta. And I personally thank Sandhya Manian for giving us the time and her esteemed and sharing her esteemed knowledge about the disease process and the interventions that they do at a level of nutrition, which I think is of extreme importance in controlling the diabetes and managing the complications. And without further ado, let me go ahead with my thing, and let me just share my screen. Are you able to see my?
Yes, we can see your screen, but not the, yeah, there we go. And so just a quick shout out to the attendees. So we do see a healthy number of attendees for the webinar attendees. Please do keep putting in your questions in the Q&A section, and we'll have them answered by the guest speakers here. Thank you.
So Sandhya was telling about do not do the Google search for the GI and GL, and so I just wanted to put up a slide which will direct most of our attendees to the exact. I mean, this is much more better than what we usually find on the Google search. So so what is diabetes? So I'm
Sorry,
a cardiologist.
Dr. Raghu, sorry. Can you? I think you're not in full screen mode.
Got it?
Yeah.
Okay. So let me just take this one a little bit so that I can see my. Okay. So what is diabetes, like me being a cardiologist, like, I mean, why is diabetes so important for a cardiologist? Like, so the first and foremost is like, diabetes is one of the major risk factors for people to develop cardiovascular disease. And cardiovascular disease is a complication of diabetes. And so I'm coming from the other end, like now, which Sandhya was talking about, like now the front end, I'm talking from the back end of the system. And so the spectrum is very, very large. And to explain diabetes, it is in a simplistic way, it's too much glucose in the blood and too little in the cells. These are two very important physiological parameters that lead to most of the symptoms that diabetics will feel. So in a nutshell, like there are two types of diabetes. Type 1 is mostly immunological and it's very, it's less common, like less than 5%. And most of the big thing like is the diabetes that we have is type 2 diabetes, which is mostly because of the resistance to your insulin and abnormal insulin production. Whereas type 1 diabetes, like you have a problem with the production of insulin by the pancreas. So you have either too little insulin or absolutely no insulin. So two different and very, very different spectra. So what happens like when you have abnormal insulin production, which will be the first thing that happens in the diabetic or pre-diabetic stage, or what we call like an impaired glucose tolerance. Impaired glucose tolerance, pre-diabetes, interchangeable, and then like you become a diabetic. And then like you develop like an insulin resistance. So your body will try to like produce as much insulin as possible, depending on the foods that we eat. I'm not going to go back into like types of foods because Sandhya has very beautifully elucidated like all the foods like that can cause the glucose spike and explain the glycemic index and the glycemic load. And so when you eat like a food which is very high in glycemic index and glycemic load, then you'll have excess glucose or the glucose curve will be very high. And so there's too much glucose available in the body. When there is excess glucose in the body has a mechanism called insulin. So pancreas gets kicked up by what she told about the GLP. So there are special substances that are produced by the gut, by your stomach, which are called secretins or incretins, like which are the ones which stimulate the pancreas to produce insulin. So when you see a glucose spike in the body produces these secretins or incretins, the GLP-like substances, then you'll have a very high spike of insulin. So that initial spike, like you got to remember, that is the most important factor in controlling your blood sugars. What is happening to the blood sugars in the body? And then you will have a plateau, a slow flow. So what happens in diabetes is because of the loss of the initial spike and because of excess insulin production, you develop like insulin resistance. And insulin resistance is because of multitude of reasons. And one of the main reasons of insulin resistance is the deposition of fats in the organelles. And the organs like that are very sensitive to insulin are number 1, fat cells, number 2, muscle, and number 3, the most important like is the liver. So these 3 organs like are very important in controlling like your blood sugar, where the blood sugar, where your glucose is put, whether it's put in the cells, in the liver, or like it is left in the blood. So if it is present in the cells, it's a good thing because cells need glucose. You don't have glucose, we die, as simple as that. So you need glucose for the cells. But the problem is the availability of glucose to the cells, like that is diabetes. And then what happens with the excess glucose that is present in the blood over a period like now will go and bind to whichever cell it can attach to. So you might have heard like people saying like my shoulder is hurting, and you go to the orthopedic surgeon, and the first thing that the orthopedic surgeon will tell you is, do you have diabetes? So people will be thinking like, now what is talking like? Now, I'm talking about the shoulder pain, and like why are you talking about diabetes? Because what happens is in the shoulder that use the maximum, because if you are a right-handed person, use the right shoulder the maximum. It is the most mobile of the joints. And glucose goes and deposits there in the synovium, in the fluid, and it forms crystals, and that causes pain. So that's a simplistic way. And that is the main cause like for all the problems that we see in diabetes, which I'll be talking about. So as Sandhya told, like her client Raju, like as I told, like I'll be talking about the other side. So he had decreased energy and chronic fatigue. He has a high incidence of neuropathic pain. Like he was not able to sleep well because of excess glucose like in production. If you see this one here, can you see the my pointer going? So this is what like the cause for when you have excess glucose in the body, you'll have peripheral neuropathy. And this is what happens, like pins and needles in the night times, you can't sleep. That is a common complication. And then the decreased energy level is because of loss of availability or decreased availability of glucose for your metabolic needs. And then the third and the most important thing here we have is for a person who do not have a good blood pressure, good glucose control is very high, high rate of complications. And the complications can happen because of small vessels or medium-sized vessels or large vessels. So usually like small vessels are microangiopathy, big name for that. And the common things that we have are number one, like retinopathy, which is here, if you see on the far right of the screen or the left, whichever you want to call, that is what happens. You see lots of hemorrhages happening in the eye, and that causes a significant problem of vision loss. Next is the kidneys. And you can see like most of the people, the common precipitating factor for kidney problems in the world will soon be diabetes. And then coming to my complications, which is cardiovascular, which is heart and the other vascular systems. So we need blood supply to every organ in the body. It's not just the heart, it's not just the brain. Every body, every cell, every organelle needs blood supply. And that blood supply is by blood vessels. And when you have problems with the cholesterol deposition because of diabetes, that's what happens. You can have stroke, you can have heart attack, or you can have decreased blood flow to the legs, like leading to amputation and gangrene and lots of complications. So I don't want hover here for a long period of time, because most of you will understand people with diabetes will have a heart attack, people with diabetes will have a stroke. And so now comes, what can we do about it? And I remember a very nice quotation by John Muir, beyond those 2 pine trees lies a beautiful world beyond, and you want to enjoy that world. And so how to get there, how to get beyond those 2 pine trees is where Sandhya's intervention is coming. And when you come to me, the problem is magnified. Diabetes can be reversed, but complications may not necessarily be reversed. Insulin resistance can be reversed in the early and in the early phases. But when the insulin resistance is to the point where we have significant fat deposition in the cells, that fat will not let insulin bind, or insulin receptors respond to the insulin. So you got to be careful where you are. And the most important things are, and this is what called the 3 pillars of diabetes reversal. First is diet, which she has elucidated very well. Eating foods with low GI and GL food. Next is exercise, which is where I come in. The most important exercise that you want to do is aerobic and strength training, because you need more muscle. So you have to have strength training also, not just walking. You want to build some muscle, because muscles are very hungry for glucose, and that's where you have a bang for the buck. And then the medications, as she was talking about, it is purely under the guidance of doctor. Purely under the guidance of doctor. So the first pillar, diet. So the postprandial blood sugar control, why is it so important? Because this is what determines how you're going to do in the long run. Better postprandial blood sugar control, the less the complications. So this has been shown in multiple studies. I think I've reviewed around 40 to 50 studies where people have been telling, and most of the scientists have been looking at this thing, and what they felt was the most important thing is postprandial blood sugar levels, and the second most important is fasting blood sugar levels. So as I don't want to spend more time, so what do you want to eat is previously we cardiologists used to say good fats and bad fats, and proteins are good, and we never spoke about the carbohydrates. But now we're talking about what is called, the concept is coming, what is called good carbohydrates. Good carbohydrates are complex carbohydrates. So the amount of carbohydrates that you take, if you are eating a lot of salads, these are complex carbohydrates, because the body, it takes a lot of time for the body to break them down. And in this gut, you have special enzymes which break these carbohydrates in simple carbohydrates. And so if you have simple carbohydrates, which is the refined products that you eat, it doesn't take much time like for it to be absorbed. Or if you take like high sugar levels, which is glucose, and the other problem is like a fructose, these two like now will balance out each other in where they cause the problem. So we have to move away from simple carbohydrates to complex carbohydrates, meaning you do not want to digest your carbohydrates easily. At the same time, like you don't want to go into keto foods, like because what is happening is if you remember what I told you, fats are the killer for a cardiologist or for anyone. The amount of fat deposition in the body, in the cells, from the adipose tissue into the muscle or into the liver is the main reason as to why, like one of the main reasons why you develop insulin resistance. So you want to cut down like the fats that are available in the body, the fats that are like going and getting deposited in the muscle or in the liver. Just remember this. So how do you avoid like the fats is you want to pull the fats out of those two organs for your energy, because fats are the best form of energy source that we have. Each gram of fat gives you 9 kilocalories, whereas carbohydrates and proteins, they give only 4 kilocalories. There is a reason as to why we store fats, and we have to use those fats in a very prudent, in a very nice way, which we have done like for almost 500,000 to 600,000 years. But with this new refined foods, like we moved away from that. So then like you have to have the fiber, which is extremely important because fiber is indigestible. And so you want to have both a soluble and insoluble fiber, and you have a balanced mix of soluble and insoluble fiber so that you can avoid like most of the complications of bloating or gut constipation. So then comes the exercise. Why is exercise so important? Because once you exercise, and exercises differently. You can have multiple aerobic exercise, or like you can have in aerobic, you can have cardio, or like a high intensity, or strength training, or resistance training. So whichever spectrum you choose, you have to have a mix of everything. So when you have a good mix of cardio and strength training, that is where like now you do see the maximum benefit. And when to exercise and how much to exercise. According to the American Heart Association, we have to do around 150 minutes of moderate exercise. That was like, was the recommendation from both American Heart Association and American Dietary Associations. Then we have a new concept which is coming in, which is when do you want to exercise? Most of the people say get your exercise out in the morning. Good. If your lifestyle has demanding like that, you have to get that much of an exercise. Doesn't matter, like, when you get the exercise, do it rather than not doing it. But the best bang for the buck is post-meal, because immediately after you eat meal, you will have some carbohydrates. When you have the carbohydrates, you're going to have like, a glucose spike. So you have readily available glucose in the blood immediately after eating the meal. And the problem with diabetes is you do not know what to do with this glucose. Because you have insulin, you have too much insulin or less insulin, it doesn't matter. You do not know how to handle this glucose. So you want to bring it down. So the way that to bring it down is like you want to engage the organs which are very hungry like for glucose, and the organs which will be very hungry for the glucose will be the muscles which are exercising. So you want to do exercises which engage big muscles, and the big muscles of the body are the lower extremity. And I just gave you, this is one of my kicker exercises that I'm going to advise for every woman in the world who are above 40, because not only like, it expends energy, it decreases like the rate of heart complications, and also like rate of osteoporosis. And it's a very simple exercise. Anybody can do it. Like that's my son, like it's an old one. My son is grown up now, but the beauty of this exercise is it is such a simple one. You can just put a gel mat anywhere in the house, and you can start exercising. And immediately after eating, if you just do this for 10 minutes, it's a very low impact, because if you see like now the kid is landing on his forefeet or the midfoot, and he's not hitting the heel. And if you can see the whole body is moving up and down, like so you're going to have a vertical movement, like which will cause a thumping motion of the vertebra, which for women is extremely important. Then like for medications, like she spoke a lot about the medications, so I'm not going to spend a lot of time in the medications. And I would go for the rule of thumb. Like now is the simple hacks for glucose spike control is number one. You want to have something that doesn't digest well, like there's the first one, so that it forms a coating, which is the fiber. And then like now you eat your protein. Then like now you have your simple carbohydrates. And the other most important thing is do not sleep or rest after the meal. walk for 10 minutes, even if it's inside your house. So then, like now, important management, like now, it's a very important tool for the management of diabetes is you want to decrease the insulin spike. You want to flatten out the curve as much as possible so that like whatever glucose is available is used by the tissues. The second thing is, if you look at like what Raju has done, he's been eating too many meals like from my side. So if I have like an advice Raju, like even then, like he's got a good control of his diabetes, like with the management, like what Sanjay gave. If I have to give one more thing would be the most important thing is decrease the number of meals and have a food that has high satiety index. So because this is extremely important in the management of diabetes, because when you have an insulin resistance, you don't want to have multiple insulin spikes because you're losing the most important insulin spike, which is the initial rapid insulin spike, which is a very high spike. Now, if you're eating like foods of low GI and GL, even then like you can have some insulin release. And so this low insulin level or like low insulin levels will accentuate, means there are studies that are coming out, like just studying about this. We're not 100% sure, but we are going there. So you want to eat fewer meals than like now increase the number of meals because you're decreasing the number of insulin spikes per day. And the best form of decreasing insulin spike is 1, 2, or 3 spikes. That's it. I usually advise 2 insulin spikes, meaning like eating 2 times a day, and you modulate. If you have an insulin or some medications, you need to get the guidance of your physician. This is called time-restricted eating, and that is coming out like as one of the major implications, like on how you manage your diabetes, early or late diabetes. And now, like most of the stuff they have about the glycemic index and glycemic load has been elucidated. And if you look at the macros also, the most important thing what she was telling is the fiber and the net carbs. If you look at like the most of the common food that we eat, like the jowar, the bajra, the ragi, like the important millets, like now they have other medicinal good properties. But thing is, when it comes to diabetes management, if you look at it, the amount of net carbs that are available in jowar is 66. And the fiber is, no, I'm sorry, total carbohydrate is 66. And the fiber is 10. And so the amount of net carbohydrate that is available per 100 grams is almost 55 grams of like a carbohydrate. And then the glycemic index of jowar is 77. If we correlate these two here, this is what I want you to do, not just go by one thing. You have to look at like now both, which will be like a glycemic load. And if you look at the bajra, like now the fiber is only 9 and the protein is 13. So, and then ragi, the protein is extremely low, fiber is low, net carbs are high. If you look at wheat, like now the protein is 12 compared to bajra, and then the fiber is 14, like pretty high. This is not refined wheat. This is called the bulgur wheat. And the net carbs are still high. And then Dheeraj will talk about like the product like that became out, which we'll talk about like the macros and the glycemic index and the glycemic load of the product. So now like the challenge is very simple. Like I mean, if you want to see where you are, whether you are pre-diabetic or impaired glucose tolerance, whether you are a diabetic, or if you're prone for like a diabetes, meaning like if you have a genetic predisposition for diabetes, this is a simple challenge that we say is test for yourself if a product, anything of a choice, is helping with the blood sugar management. So first is prepare the meal, then check your pre-meal blood sugar, eat the meal, wait for 90 minutes. Why 90 minutes? People say like 90 minutes is postprandial, and if you want to go for a glucose tolerance is 120, nothing wrong like going either way. Like if you want to go 90 minutes, you'll see if there is a good response. If you have 120, like you see like there's an average response. And then you calculate the glucose rise, which is a simple thing is the post-meal glucose, it will always be higher, hopefully, on the pre-meal glucose. And then use like the product that Dheeraj like is going to talk about, our product. And then like the challenge is very simple. Compare these two and you will have the result with yourself. The other thing that I want to tell you is, yes, like I mean, when you do all this, you want to have a food product that doesn't increase your blood sugar level in the postprandial state throughout the night or whenever you eat. So there was a big movement towards keto diet. So people are eating keto diet, meaning like there's absolutely no carbs in the system. So that should help with the diabetes very well. Yes, it will help, like, because there's no carbohydrate there. But what we found is, like, there was one major study that came out of American College of Cardiology, wherein there was an increase in the incidence of both coronary artery disease, which is blockage of the blood vessels, and increase in the presentation of heart attacks. There's a 50% increase in the presentation of heart attacks and 100% increase in the coronary artery disease. So what you're doing is, like, yes, like I told you, like, you want to take the fat out of the muscles and the liver and use fat for your energy. But what you're doing is, like, you're not allowing that, like, because you're giving fat into the system again. So the fat that you have in the body, in the organs, particularly the muscles and the liver, is going to stay there. So it's not going to affect, it's not going to cause any effect on your metabolic syndrome, how you're going to modulate, like, your fats in the body. So you're, in essence, what you're doing is you're causing a bigger harm, trying to, like, help yourself with the diabetes without knowing, like, what you're doing, because this happens at a metabolic level. You can't see that, like, for 3 months or 6 months. Whereas with the blood sugars, you can immediately see, like, as I told you, like, with the challenge, if you look at the challenge, it is very easily, like, with the blood sugar, oh, my blood sugar is under control, so everything should be under control. Yes, until this keto product has come by. Can you eat keto at all? Yes, you can have a keto product here and there, like, for breakfast, or, like, one meal, but not like all 3 meals or all 2 meals, or for a long period of time. And with that, like, I think my presentation is done.
Right.
So,
Yeah. So
was I audible? Like, was it good? Were you able to hear me?
I think, yeah. I think we have a few people. So Anusha, do you think you can actually type in the question? I could see that you've actually raised your hand. Can you please type in your question? Thank you. Dr. Raghu, thanks a lot for the talk. So again, I've been taking some notes, and if I had to come up with three key points there. I think the first important one lesson or takeaway for me was diabetes is a silent killer that causes complications in other body systems, and typically by the time it actually comes to someone like you who's involved in cardiology, it might just be too late that you could actually reverse the complications that is already crossed. And so that was one. So you probably need to be far more informed about uh, your risk to having diabetes, or if you're a pre-diabetic. And the second one is, I think the other thing that you mentioned was the postprandial blood glucose control is one of the critical levers that anyone has in controlling their for diabetes management or its reversal. And the last one is because postprandial glycemic control is really important, you would also put a focus on glycemic index and glycemic load of the foods that are being consumed. And in addition to that, you're actually challenging the audience to adopt a results-driven approach and asking them to, just get a glucometer and try out how their bodies are reacting to different foods that they're actually eating, and then make an informed choice of how they want to eat and what they want to eat. Okay. With that, so we have quite a few questions that are coming up. So I was thinking, in light of time, we should probably go to the Q&A. So I would just bring up the questions. Either Mrs. Sandhya or Dr. Raghu, feel free to answer whichever you think is relevant to you. Okay, the first question that we have is, my mom and dad are diabetic right now. I'm in second trimester. What precautions I'm supposed to take? So who wants to go for this?
I would like to answer that. I think that was Anusha Potluri. So the first thing that I would suggest her is to cut down the refined sugars and cut down the refined carbohydrates. Step up the vegetable intake. Make sure that every meal has at least a cup of vegetables, and you start your meal with that vegetables, and then you go on to the protein and the carbohydrate. Educate yourself about carbohydrate. It is not only about just eliminating sugar and then replacing that with something else, or it's not only about, say, not eating a coffee, not having a cup of coffee or tea, but there is much more to it. We have spoken so much about the GI and the GL. So understand what is the low GI food, understand what is the low GL food, and look for options where you're reducing the glycemic load of every meal that you eat. And make sure that you're getting your movement. So I understand you are in second trimester. I hope your nausea and everything has been settled by now. So I'm sure you will be able to go for walks. And nowadays you have a lot of guidance on what kind of activity that you can do under guidance during pregnancy. That will also help you in your delivery and postpartum recovery. So make sure that you make that time for your physical activity. It will not only prevent you from gestational diabetes, and it will prevent a whole lot of complications, and it will also help you to recover faster during your post your delivery. Yeah, that's my answer.
Thank you, Mrs. Sandhya. So we'll take the next question. So this question is on protein leakage in urine or microalbuminuria. UACR is 63. How to plan diet? How to plan diet with this as well as diabetes?
Doctor, I'll go first and then please add on. I'm sure you will have a lot to add to this. So when your sugar levels, when your protein levels are disturbed, then it is better to go for a customized plan. That is number one. Number two, you will not be able to go on a high protein diet. So you have to cut down your protein, but you have to compensate for that with a lot of vegetables. So when you increase, say about 60% of your every meal is vegetables and is loaded with a lot of fiber, and you're opting for a low GL and low GI food, then you can manage your sugar levels. Along with activity, you also have to build your muscle, which may not happen with protein, but as much as you exercise, at least you will retain the muscle that is present in your body. And with this, you should be able to manage your microalbuminuria and also maintain or bring down the sugar levels further. Now, I leave the rest to Dr. Raghunath. He's an expert in this, so I would also like to learn from him now.
Well, I'm not an expert, I'm not a nephrologist, but the problem with diabetes is like now when you have early stage of diabetes, the main filtering organelle in the kidney is called a glomerulus. That is where like now your blood will come in and then like it will interact and then like the filtering process happens. And then like we filter like now in whatever is necessary, like now in for the body, and filter out like whatever is not necessary, which is mostly urea compounds and like other urine products. Because of these macro, like because of excess, like blood coming into the glomerulus, because the glomerulus becomes big, you have like what is called macrofiltration, meaning the filtration level goes up. So when the filtration level goes beyond a certain level, meaning like you're asking your 1 horsepower motor to work as a 5 horsepower motor, then what happens is there'll be a lot of leaking happening. And there's also like leakage in like the basement membrane. And so when that happens, like you'll see like the first sign that you see about like kidney problems being affected by diabetes is microalbuminuria. That's why when you go out, like now your physician will first say like, give me urine sample. And that will tell like whether you're having like microalbuminuria, and then like that is the indication. That is your first sign that like you have to have a very tight control of your diabetes. And as Sandhya was talking about, because like we do not know like which stage of kidney failure you're in. Initial phases, protein is not bad, but when you go beyond stage 3B, which is stage 4, early stage 4 and beyond, that's when like you have to limit your protein consumption. And again, like comes like my favorite thing, which is complex carbohydrates. Like you got to worry about like you don't want to eat simple carbohydrates. You want to have complex carbohydrates.
Right.
And when you have microalbuminuria, it is better that you consult a nephrologist once.
Yeah, so sorry, we just have a lot of questions, so I would really urge the panelists to keep the answers slightly shorter. So the next question I have is, I'm going to combine a couple of questions. This is specifically with regards to Ruby Roti. So how can Ruby Roti help in improving diabetes? And the other one related to it is, what is Ruby Roti made of? So Dr. Raghu, maybe this is something that you can answer.
Yeah. So my thing was like I've been seeing like a lot of people like with cardiovascular problems, particularly young people, and the common precipitating factor, common risk factor like in these people is diabetes. So I said like what is it that we can do to help people with diabetes not to have a very drastic change in the lifestyle, because those drastic changes in lifestyle like can be sustainable only for a brief period of time, and after that like and also with this modern world like it's not possible for you to go and hunt and buy like all the stuff like that is extremely good. And so I thought, is there a way that you can combine all these things and produce something that will satisfy my needs and then the diabetic needs? Number one would be like I want to have a product with a low GI, Number 2, with a low GL product. Number 3, like I want to have a good mix of soluble and insoluble fiber. Number 4, like I want to have a good fat profile, which is like very high in unsaturated fats and very low saturated fats. And if it can be made in such a way that like it becomes a staple product. So if you look at like the staple products, like now when you have like either rice-based products, or wheat-based products, two very, very important things. And then the rice and rice-based product, like you have to have a genetic modulation like before you can alter what rice can do, because it's a single ingredient. You cannot mix anything like to make anything look like rice. So that thing is off. That's why if you see like most of the products like with low GI rice and all those things, you barely hit like under 55 GL and like under 20 GI and under 20 GL. So that was one of the reasons as to why like now when I thought I have to do something. And then like now we with the team like that we have 6 people in the team. All of us, we put our heads together and we brought about a product wherein if it is like a roti, don't think of a wheat roti. This looks like a roti. Think of it as flatbread. So when we make something like a flatbread, we can mix and match. So when we mix and match things, that's where like we want to have the best of the ingredients, and so that like we can negate like the bad things like that come with simple carbohydrates. And also when we mix things, the chemical reaction happens, and basically like now when we mix and when you heat them, that is where like the binding of these good things happen. And that is what we achieved like now after like 175 trials. So what did we achieve? Number one, like a product which has extremely low GI, extremely low GL, extremely high protein. Like if you take 100 grams of our product, you will have close to 39% protein. And then if you see the amount of carbohydrate that are present, the dietary fiber is 19%, but the total carbs is 33%. So it's not a keto product. And the quality of the carbohydrates is so high that when we got it tested, like now in UK, and I think like Dheeraj is going to talk about it, that we got an extremely low glycemic index of 4.4, an extremely low glycemic load of 0.5, and it is not a keto product.
Right. Thank you, Dr. Raghu. So the next question that we have is, in how many days can we see a significant difference once we start following this diet? So by this diet, I presume it could be either of the diets that the panelists have recommended. But I don't know, Sandhya, do you want to answer this question?
Sure. So if you follow the norms, you will be able to see difference in symptoms definitely within 3 to 4 weeks. Your fatigue and your sleep, all of this gets sorted. And biochemical parameters, give yourself at least 3 months time to see a drastic difference, because HbA1c is glycosylated hemoglobin. So the cycle of your RBC is almost 90 days. So give that time. So 90 days of time for you to see significant difference. But you will begin to see difference in your fasting and PP within a week's time. And one more thing that I wanted to add about Ruby Roti is I have been trying this product with many other clients. The first important factor that they tell is it's highly satiating. Just 2 rotis, and you don't have the necessity to eat for at least next 4 to 5 hours. And I agree with doctor to reduce the number of insulin spikes in a day. But there hasn't been a product which will just keep you satiated for 6 hours. Even a protein shake keeps you satiated for only 3 hours. So we have challenge in that. And this product has been found to be the right fit, where it is going, in coherence with your regular meal plan, but also keeps you satiated for almost 4 to 6 hours. So I'm looking forward to implement this in more people to reduce the number of spikes. Thereby the results is even more faster.
Thank you, Sandhya. The next question that we have is, this session was really helpful. Thank you so much, sir and ma'am. But I have a question about insulin resistance. I'm frequently hearing this these days. Can you please explain that?
Yeah, I can do that. So insulin resistance is insulin. I told you like now is a hormone. The main and the most important thing for insulin to do is to control your blood sugar, meaning the available blood sugar has to be pushed into the cells. The next one is like now it also like pushes the fats into the cells. These are 2 things like that you have to be very important about. Now, as we develop diabetes or as we develop pre-diabetes, what happens is there's too much glucose in the body and there's too much insulin production initially before you become pre-diabetic. So as the insulin production increases, then as the fats get deposited in the cells, and there are like 8 different reasons as to why, or 9 different reasons as to why you can develop insulin resistance. And that is beyond the scope of this thing. Your most important thing is your fats. Number 2 is vitamin D. Number 3 is like now the amount of muscle that you have, and all these things will play a factor in how your insulin resistance and the amount of exercise and whatnot. And then some other immunological things, your oxidation status and your availability of oxygen. Big thing, but most important thing is when you have higher insulin levels in the body initially, the receptors, like they become resistant because of the amount of fat that is present. Simplistic put. And so your insulin is there, but your cells are not receptive, meaning glucose has to be taken into the cell, and the cell has to take the glucose inside and use it like for its energy requirements. So right at the junction of the glucose entering the cell, that is where like glucose is going to affect. It's going to change some conformation so that the gates are open. So if the gates are not open, glucose cannot go in. As the glucose doesn't go in, there's glucose availability. So the non-availability of glucose to the cell, meaning the cells are resistant to the action of glucose because of multiple reasons, is called insulin resistance.
Right. Thank you, Dr. Raghu. So there's 2 questions I'm going to club into one. One is, can glucometer-based tracking be accurate? And the other one is, can you enlighten me on CGM? So essentially on glucometer and CGM and reliability of, how reliable are the readings from them? Either one of the panelists, if you want to make a comment on it, or
I can take it. Like, I mean, CGM has found a very important role in the current management of diabetes, particularly for type 1 diabetics, because that is where like you need like very, very accurate level of your blood sugar management, because you want to have the insulin supplementation. So it has to be very tightly regulated. Previously, like it was extremely difficult to manage, like because each meal in each state of your physiological status, like will determine like now how much insulin you need. If they don't have insulin resistance, but there's no insulin. So that's why like your CGM, which is a continuous glucose monitor, when it is linked to like your glucose pump, like then you will have a very good response of your insulin in the body to utilize like an amount of glucose. So is it helpful in type 2 diabetics? Yes, it is. Is glucometer helpful? Yes, it is too. But the thing is, like, you got to be very prudent about how you check your blood sugar levels. Pre-meal, anybody can check, which is a random one. Fasting is very easy, like, because you don't eat anything, you wake up and you check your, so they are accurate. But the post meal is where like most of the people falter, like because waiting for 90 minutes or 120 minutes, like or where it happens, you won't see like the curve whether you're having a very high spike and like coming down, which is an insulin resistance, or like high initial phases of diabetes, or like whether you have like a full-blown diabetes, like where you don't have much of a insulin response. So you got to be prudent. So when you go with the glucometer, like it's going to be a little bit more difficult, but CGMs, that's why CGMs are becoming very popular.
right.
And another important use is also it's not that the fasting and the postprandial that we take in the morning is going to be spiked for everyone with diabetes. So the spiking can actually happen anytime during the day. It varies from individual to individual. So for some in the morning, it could be absolutely normal. But when you look at the HbA1c, it's going to be elevated. CGM gives you a clarity on which part of the day their food is going high. So depending on that, you can navigate your meal plan accordingly, and then you can count the carbohydrate and fit it in such a way that your HbA1c comes down over a period. So CGM it's a new thing, and it is giving us a lot of clarity on how to modulate the diet and when to have the activity for that particular person, depending on when the spike is happening for him or her in a day.
Yeah, thank you, Sandhya. So Adarsh and Rajgopal are the 2 people who have actually asked this question. So we do have a webinar coming up from an educator who's actually well versed with how glucometers and CGMs work. So please do watch out for those communication from us. Okay, so there's another question here. on, okay, what are the ingredients in Ruby Roti and what is Ruby Roti? So we will send out communication about Ruby Roti along with the video of the webinar. So simply put, I'm like, Ruby Roti is one of the conceptions of the research that Dr. Raghu has done, and it has one of the lowest glycemic indices that been tested in India and possibly the world. So we will send out communication. So we're just going to move on from these questions. So Sandhya, maybe this is a question for you. What are plant proteins commonly used? I presume in a vegetarian diet context, if they wanted to have good sources for protein, what is it that you would actually recommend?
Sure. So if you consider milk into vegetarian, then definitely milk is a good source of protein, and then paneer, and then cheese. But in moderation, the portion size is very important because cheese again can be very high on fat. Then you have tofu, which is a good amount of protein compared to paneer. Tofu, I would say, is better in terms of calories. It is lesser in calories and almost equal amount of protein. Then you have all the lentils and dals, which are rich in protein. And when you consider grains, quinoa is comparatively having better amount of proteins, and mushroom to a certain extent also have some amount of protein. And all the bean kind of vegetable like your avaraka, your broad beans, your beans, about 100 grams gives you 3 to 4 grams of protein. So overall, if you are into a vegetarian diet, you have to plan it in such a way that you get protein from different kinds of sources and you have it across every meal. So, and every snack, where your nuts and seeds are also good source of protein. So you plan it out in a certain way that 15 to 20 grams happens during a main meal and about at least 5 to 6 grams happens in your snacking. So you're able to meet the protein requirement. And from the same person, I'm seeing two other questions. One is how a type 2 diabetic can plan strength exercise. This you have to get advice from a fitness expert, go sit with them, speak with them, get your plan personalized and then start, because it's not like go lift a 5 kg dumbbell. It really depends on where you are at the individual level, how much you can lift, what is your level of injury and what is your level, what is your capacity. And based on that, you have to plan your exercise. So reach out to
I
experts.
can.
And if it's about reducing diabetes without medication, it again, they really depends on how many years you have been diabetic, what is the stage, how much medications you have been taking, and depending on that, it varies. So we can't say give up medication. That should not be done because you're following diet. It is as doctor explained, 3 pillars of medical management. It is one of the important pillar. If you take care of the other things and then reduce your sugar levels slowly and steadily, and then you're maintaining, then your medications definitely have the possibility to taper down. And in some cases, you can also quit medication, but all of this has to happen under guidance.
Yeah, I'll pitch in a little bit about exercise because people have very different approaches to exercise, like because they get advices from different sources. But the most important thing is there are two types of exercise that you have to understand. One is you want to have a good aerobic exercise. The beauty of the aerobic exercise is you're shifting your body from pure carbohydrate metabolism to fat metabolism. It takes around 3 months for the body to understand what you're doing. So you want to go to a good fitness guy and ask them about the aerobic exercise, and then you want to go for the heart rate zones. This is extremely important. You don't want to go into heart rate zone 5 where you're going to 100% of your heart rate. You do not want to do that because we do not know the status of your blood vessels. So when that rupture is going to happen with the plaque, nobody can understand. So you do not want to stress your heart too much, number one. And number two would be the strength training. You want to strengthen the big muscles, which is the lower body. The fad is they want to build more biceps, more shoulders, and more look heavy. But top heavy is extremely dangerous, and it's been proving that most of the countries which are top heavy have significant problems with the axial skeleton. So you want to bulk up the muscles which are big, and you want to decrease the amount of fat in the muscles. As I've been telling you, fat in the muscle is a problem. So you want to bulk up the muscles, which are the lower body muscles, and the exercises have to be catered towards that.
Yeah. So just to add on to it, so we would be doing a series of webinars specifically focused on exercises as well. So please do keep an eye on the communication from us, and you would be seeing specific webinars on these topics, some of the questions that you've actually asked today. Okay, so the last two questions, I think we're already over time here. Uh, when should one shift from injectable insulin from tablets? Abhijit, so I'm not a doctor, but I would just straight away say this is probably not a forum that you'd want to ask this question. It has to be it has to be given advice given by your doctor or endocrinologist. It's probably not something that you want to take advice from on an online discussion. And then the other question is, protein in ruby roti won't be a problem from microalbuminuria. Okay, so right, how many rotis made of it can I have at a time and the day of eating?
I can answer that. Like the thing is, microalbuminuria doesn't mean like we have a big problem like with the kidney, or it can also like be like a problem with the kidneys. So you have to go to your physician or like a nephrologist to see where you are in the spectrum of chronic kidney disease because of diabetes. So if you're in early phases, stage 1, 2, 3, 3A, 3B, up to 3B, like I think we should be okay. Like, but thing is, do not quote these things because it is the nephrologist who will decide how much of a protein you need. Because early stages, you need more protein. And late stages, like no, you have to cut down your protein because you cannot like metabolize like the amino acids. So your kidney doctor will specifically say the amount of protein that you can do. As a rule of thumb, normal requirement or like suggestion, dietary suggestion would be 0.8 to 1 gram per kilogram of protein per day. If you are a heavy into exercise, like heavy lifters or heavy exercises, then they could go up to 1.2 to 1.5. But you want to mostly for normal people, you want to be within like 0.8 to 1 gram per kilo per day. But when you have microalbuminuria, we do not know where your kidney function is, whether you are good or whether you are bad. So if you are bad with microalbuminuria, then it's not a good thing. So you got to go onto the guidance. And so the number of we have on website clearly as to how many grams you get of protein you get per roti, and so you can just calculate and then but
So,
most important thing is follow the guidelines.
yeah. So, Dr. Raghu, so I think with ruby roti, we have, I think, 9 grams of protein per roti. So, based on the guidance that you're talking about, so I don't know who the questionnaire was, but based on the guidance given, you probably want to calculate the protein consumption and, design your diet accordingly.
Exactly.
So that was the last of the questions, and unfortunately, we can't take any more questions.